Before we begin, we would like to acknowledge the traditional custodians of the lands on which we all meet today and pay respects to elders past, present, and emerging. I'd like to acknowledge that I'm joining you today from the lands of the Darkinjung and Gurungai people. I'll now hand over to Kath Young and F.A.S.T Camino, two of our Strokeline health professionals, to begin the presentation. They will answer your questions at the end of this session. Thanks, Kath and F.A.S.T.
Thank you, Ash. Hi, everyone, and thanks for joining us for the Stroke Recovery webinar. Today, we're going to be talking about the My Stroke Journey booklet, how to reduce the risk of having another stroke, the effects of stroke, and what to do when you leave hospital, including the supports that are available. If you take anything from the webinar today, please take away hope and the knowledge that you are not alone. We're here to support you and will give you information about how to connect with us as we go. As Ash mentioned, our Strokeline health professionals, F.A.S.T and myself, will be joining us to answer questions at the end. Now let's get started. Stroke Foundation has written a booklet called My Stroke Journey. It answers questions about stroke. It has stories about stroke survivors. It also has contact details for people who can help you. Hospitals give My Stroke Journey to patients who have had a stroke. If you don't have a copy, it's on the Stroke Foundation website. You can click on the link in chat to have a look now. Or if you would like a copy posted to you, we have a link in the chat to order one directly. You can also call us on Strokeline. We will give you the phone number later in the webinar. Your stroke booklet might look a little different. You might have the Easy English My Stroke Journey or Our Stroke Journey for Aboriginal and Torres Strait Islander people. The Stroke Foundation also has information about stroke in languages other than English. Your treating team or Strokeline can help you get the information that is right for you. Strokeline provides advice on stroke prevention, treatment, and recovery. Strokeline is a practical, free, and confidential service. The allied health professionals on Strokeline can help manage your health and live well. You can call 1-800-787-653 Monday to Friday from 9 a.m. to 5 p.m. Victoria, New South Wales time, or Australian Eastern Standard Time, or email strokeline@strokefoundation.org.au. So, what is a stroke? A stroke happens when the blood can't get to part of your brain. This means some of the brain doesn't get oxygen, and that can cause damage. There are two types of stroke: the ischemic stroke from a clot or the hemorrhagic from a bleed. Ischemic stroke is a blockage. This happens when a blood clot forms and travels through the bloodstream to the brain and blocks a blood vessel there. A hemorrhagic stroke is from a broken artery in the brain. When the wall of the blood vessel breaks, the blood leaks into the brain, injuring that area. The image on the screen is in the My Stroke Journey booklet. Ask your stroke team or GP to put a tick next to the type of stroke you had. It is important for everyone to know the signs of stroke. The FAST message, that is face, arms, speech, and time, is an easy way to remember the most common signs of stroke, as shown in this video. There can also be other signs, including numbness, clumsiness, or weakness on one side of the body, dizziness or loss of balance, loss of vision in one or both eyes, a severe and sudden headache, difficulty swallowing, nausea or vomiting. Never ignore the signs and always call 000. I'm just going to play this video here.
Stroke can happen to anybody at any age. The best way to help someone is to learn the signs of stroke and know how to act fast. F is for face. Has their face drooped? A is for arms. Can they lift both arms? S is for speech. Is their speech slurred? Do they understand you? T is for time. Call 000. Time is critical. If you see any of these symptoms, act fast. Learn the signs of stroke and you could save a life.
So what causes blood vessels to get blocked or break? Why do strokes happen? I will now hand over to Fee. Thanks, Fee.
Thanks for that, Kat. Now let's talk about stroke risk factors. A stroke risk factor is something that makes us more likely to have a stroke. Certain health conditions and some lifestyle choices can put us at a higher risk of having a stroke. You can talk to your stroke team or your GP about your personal stroke risk factors are. Let's have a look now at what the main risk factors are and how they can increase the chances of having a stroke. High blood pressure is the biggest risk factor for stroke. If blood pressure is too high, blood clots can form and arteries can become weaker and less flexible. So high blood pressure increases the chance of both types of stroke, clots and bleeds. A normal blood pressure is around 120/80. Blood pressure that is regularly over 140/90 is considered high blood pressure. It is good to know what your blood pressure is. Do reach out and talk with your stroke team or GP about what your own blood pressure targets should be. Get it checked by your doctor or pharmacist regularly and take your medication. What else can help with managing blood pressure? Well, having a healthy lifestyle also helps. Remember to have the recommended amount of salt, exercise regularly, avoid alcohol, and manage stress. High cholesterol. High cholesterol can lead to a fatty buildup in the arteries. Too much cholesterol in the blood can stick to the artery walls and narrow or block them. It can stop the flow of blood to the brain or cause blood clots that lead to a stroke. To manage cholesterol, we can take medications prescribed, ask your doctor to check your cholesterol regularly, and reduce the amount of saturated fat in your diet. Atrial fibrillation, often called AF, is an irregular heartbeat. Blood doesn't flow properly through parts of the heart. When blood pools or stays still, it starts to clot. And when clots form in the heart, they can travel to the brain and block the blood flow. It's very common and is associated with 1 in every 4 strokes. Remember that medication can control or slow down the heart's rhythm and reduce the chance of blood clots forming. And having a healthy lifestyle can also reduce the risk of AF. Another risk factor is diabetes. It increases the chances of blood clots forming and of the artery walls narrowing and hardening. So what can you do? Take your medication, see a diabetes educator, and be aware that checking and managing blood glucose levels regularly is really important. Like I've mentioned before, having a healthy lifestyle will help keep blood sugars in the normal range. being overweight can lead to high blood pressure, high cholesterol, and diabetes. And as I've spoken about earlier, all of these increase the risk of stroke. Stroke teams and GPs can give advice on what is a healthy weight for you and what changes to make in your diet and activity level if you need to. Having an unhealthy lifestyle increases the chances of having the medical conditions that can cause strokes. So lifestyle affects our stroke risk too. When we look after our health, we are less likely to have another stroke. In fact, more than 80% of strokes can be prevented with a healthy lifestyle and the medications the doctor gives us. So what does a healthy lifestyle mean? Well, it means be active. Not moving enough can lead to high blood pressure and cholesterol, increasing your risk of stroke. So aim to be active for 30 minutes on most days. Get into activities you enjoy and invite friends or family to join in keeping you motivated. Second, have a healthy diet. An unhealthy diet increases the risk of high blood pressure and cholesterol and increases the risk of a stroke. A healthy diet reduces the risk of stroke and should include a large variety of nutritious foods, including plenty of vegetables and fruits, as well as cereals and grains, lean meats, reduced fat dairy, and plenty of water. Limit salt, sugar, and unhealthy fats. You can talk to a dietitian to get personalized advice about your diet. Know your numbers. The doctor will tell you what the best blood pressure, cholesterol, and blood glucose levels are for you. It is important to know and monitor your numbers and ask for help if they change. Avoid alcohol. Any alcohol increases your risk of developing an irregular heartbeat, or AF. And if you already have AF, any alcohol increases the risk of having an episode where the heart doesn't beat with a normal rhythm, and that is when clots can form and cause a stroke. And if you smoke, you can get support to quit. Smoking increases the risk of stroke by increasing blood pressure and narrowing and hardening arteries. It is never too late to stop smoking. Once you stop smoking, your risk of stroke starts to drop immediately. It can be hard to quit smoking, but asking for advice and support can help. It may take more than one attempt, but don't give up and reach out for help. The stroke team, GP, and pharmacist can all help. Contacting Quitline is also free and can increase your chance of quitting successfully. There is more information about taking care of your health in My Stroke Journey and also on the Stroke Foundation website. I'm going to pause now so we all have a moment to think about the areas we might like to make changes to help reduce our risk of stroke. Medication. Medication is very important in reducing the risk of having another stroke. It is likely you will now be taking new or different medications for the rest of your life. There are 4 main types of medication that people often take after a stroke. They are antihypertensives. These are tablets to reduce your blood pressure. Statins, which help reduce your cholesterol, antiplatelets, which reduce the chance of your blood sticking and making a clot, and anticoagulants, which help thin your blood so a clot is less likely to form. Know what medications you are taking and when to take them. Make sure you have a list of your medications when leaving your hospital and ask your GP for one. Take the list with you to your follow-up appointments. Never stop taking your medication or change your dose without talking to your doctor first. There is more information about medications in My Stroke Journey and in our medications fact sheet. You can find more information about stroke risks in My Stroke Journey and on our online stroke community website, Enable Me. We also have a number of fact sheets available about stroke risk. The links to these sheets are in the chat, or Stroke Line can send them to you. Now I will hand back over to Kath. Thanks.
Thanks, Fee. So how can a stroke affect you? The effects of stroke are different for everyone. Our brain controls everything we think, feel, do, and say. Different parts of the brain control different things. So how your stroke affects you depends on the area of the brain that is injured. It also depends on how bad the injury is. The stroke can affect moving, walking, talking, understanding, thinking, memory, personality, and behavior, vision and senses, emotions and mood, sex and relationships, depression and anxiety, how much energy you have. I want to talk a bit more in detail about these last two effects of stroke, mood and fatigue. So depression and anxiety are very common after stroke. You may have depression if you feel sad or down for more than 2 weeks. Other signs of depression are losing interest in things you normally enjoy, lacking energy, having difficulty sleeping, or sleeping more than usual. You may also feel anxious for no reason. The good news is that depression and anxiety are highly treatable. Speak to your doctor or stroke team if you have any concerns. Your GP can help you with support and access to mental health professionals. Don't ignore the signs of depression and ask for help. Lifeline provides immediate support to anyone at any time on 131114. Fatigue. Fatigue is also very common after stroke. It is a feeling of tiredness or lack of energy that does not improve with rest. It can impact your energy or your thinking or both. Fatigue can affect anyone, no matter how big or small the stroke is. It is most likely to start in the first few weeks after a stroke, but for some people, it can start months later. For many people, it does improve with time. Speak to your treating team, your GP or stroke line for information on managing fatigue. My Stroke Journey has great information about the effects of stroke and lists the available fact sheets. Ask your treating team or contact Stroke Line if you would like more information. Stroke is a big, life-changing event. You may wonder if you will ever feel the same again. Well, I want to introduce you to Paul Hollis. Paul is a retired support manager of a major government department, husband, father, survivor of stroke, and president of the Bankstown Stroke Support Group. Paul spoke to us earlier and wanted to share his experience of stroke recovery with you.
For me, the most important thing was to realise that my life wasn't going to be defined by the fact that I'd had a stroke. It was a marker in my life, but I wasn't going to sit back and say, well, I've had a stroke, bad luck, and that's the rest of my life, it's gone. You can either be passive, which many people are, unfortunately, or you can be active. I chose to fight. And the thing that I would say to anyone who's had a stroke, that recovery is a lifetime journey. And to think it could be anything other than that would be to delude yourself. I am dedicating the rest of my life to the best that I can be post-stroke.
Thanks to Paul for that message. The good news is that after stroke, most people improve with time and rehabilitation. Your rehabilitation may be in hospital, or you might go home and have community-based or in-home rehabilitation. Rehabilitation is the therapy and activities you do that drive your recovery. It helps you to relearn or find new ways of doing things that were affected by your stroke. It also helps to stimulate your brain to change and adapt. This is called neuroplasticity. Neuroplasticity. Well, this means that the brain is plastic, or in other words, able to change and learn new things. When we learn something new, the nerve pathway to the part of the brain that controls the task becomes stronger. As an example, if I learn 10-pin bowling or lawn bowls, my bowling muscles might get stronger. So will the nerve pathways in my brain that control the muscles I use for bowling. Eventually, I might be able to bowl quite accurately without having to think about it too much. This is through lots of practice. And with lots of practice, I have developed strong nerve pathways from my brain that tells my muscles what to do. After a stroke, damaged parts in the brain may repair themselves, or other nerve pathways may grow so that undamaged parts of the brain can take over the role of damaged areas. The more you do a task, the stronger the nerve pathway becomes, and the better you become at the task. So, whether we are learning something new or recovering from stroke, the key is to practice. You might be practicing to improve your writing, walking, talking, or memory. Practice every day. Do lots of repetitions. A health professional will tell you the number of repetitions to aim for. Practice at the right level of difficulty, so it's challenging, but you are mostly doing it accurately. As you get better at the task, you can move to the next level of difficulty, so you can stay challenged and can keep improving. When you do the activity lots of times, you do it accurately most of the time, and you're feeling challenged. The pathway in the brain gets stronger, which means you get better at the task. That is neuroplasticity at work, and that is the key to recovery. Change can take time, and it is normal to feel frustrated. Talk to your therapist, your family, your friends, or stroke line, and celebrate each small success and keep going. There is more information about neuroplasticity and rehabilitation in My Stroke Journey, and podcasts are available on Enable Me as well. Paul spoke to us about neuroplasticity and the importance of support. After we hear from Paul, I will be handing back to Fee. So here's another snippet from Paul.
It's important to have people around you, especially those people who care for you. And they are part of that lifetime journey that you'll have with them. You'll get support also from stroke groups around Australia, the Stroke Foundation also, and your GP. And if there's one thing that needs to be said today amongst all the other things that have been said, that don't let anyone ever tell you that your recovery journey has stopped. I was told 6 months after I had my stroke that my recovery had plateaued. There was no, this was going to be as good as it could be. I'm happy to show you that surgeon was completely and utterly wrong. Neuroplasticity is now recognized as where it's at, let's say, for the whole issue of brain recovery. And we now have a name for it, which is plasticity, neuroplasticity. And I'm here to tell you that after 16 years, since I had my stroke, I am still making quantifiable gains every single day.
Thanks again to Paul for sharing his first-hand experience of stroke. So what happens when you get home after hospital? If you have any questions about what happens next, you can ask your stroke team in hospital, or you can call Stroke Line. You can also ask your GP. It's important to see your GP in the first week you are home, as your GP can help with your medication, give you referrals, help arrange services at home, and help manage depression and anxiety. You will have appointments to go to following your stroke. These should be written down for you in your discharge papers. If you don't know when your appointments are, or if you have any, ask your GP as well. Because of COVID-19, some of your appointments might be telehealth appointments where you talk to your neurologist or health professionals by phone or video conference. You might have been referred to a rehabilitation service. We know that there are many delays in the services right now. You can call your rehabilitation service directly to ask when your program will begin. If there are long delays, you can ask your GP for a chronic disease management plan. This can help you access allied health immediately, including physiotherapy, occupational therapy, and speech therapy. Medication. If you have questions or concerns about the medications that you are taking, talk to your GP or pharmacist about a medication review. Don't ever stop taking a medication without checking with your doctor. Remember, you must wait 4 weeks before returning to driving, and talk to your GP or neurologist, and talk to your medical specialist for clearance before you do. I'll talk more about this in the next slide. Make sure you know your own stroke risk factors. Knowing and managing these can help prevent another stroke. Even if the cause of your stroke is unknown, there are still things that you can do to help reduce the risk of having another stroke. And please, ask for help if you need more support. So back to driving. After a stroke, you must not drive for at least 4 weeks. And if you have a commercial driving license, you must wait at least 3 months. This is to keep you and other people on the road safe. Before you start to drive again, you will need clearance from your medical specialist. You might need clearance from other health professionals too, depending on how the stroke has affected you. People who have changes to their vision will need to see an eye specialist, for example. Some people will also need to have a driving assessment with an occupational therapist to make sure they are safe to drive. It is your responsibility to let the state driving authority know if you have had a stroke and have lasting effects from it. The phone numbers are on our driving fact sheet. If you are unable to drive, you may be able to access community transport or a taxi subsidy. Ask your GP about these. There's more information about driving in My Stroke Journey or the driving fact sheet available online. There are services available to help you at home. The Australian government has gateways to help you get what you need. Disability Gateway helps people get disability information and services. You can contact the Disability Gateway about getting support with things like health, housing, transport, and everyday living. The Disability Gateway is for anyone 18 to 64 who has a disability. You don't have to have or be eligible for the NDIS to use the Disability Gateway. The Disability Gateway can help you work out what services you are eligible for, or help you access services, and if you need it, the NDIS. If you are over 65, My Aged Care can help with services and supports to help you stay in your own home, including home modifications, shopping, cleaning, gardening, and transport. They can also assist with short-term and respite care and with aged care homes. The Care Gateway is a great service for anyone providing care for another person. They really understand the ups and downs of caring, and they have resources and services that can help. We know how important support is after leaving hospital. Enable Me is our website with a supportive stroke community. Enable Me provides stroke information, videos, podcasts, and the opportunity to connect directly with other survivors of stroke and their carers. The website can be accessed by survivors of stroke, carers, friends and families, and health professionals as well. Enable Me is very user-friendly. You can change the settings to have it read aloud or to make it easier to read. Enable Me is where you will find the information for stroke support groups around Australia. Contact details for each group are under the section of Enable Me called Community. It is also where you will find our Young Stroke community. The Young Stroke Project has information for stroke survivors of working age, their partners, families, and their employers. Join the Australian Stroke Survivor community at enableme.org.au.